This episode is brought to you by Bumble. So, you want to find someone you're compatible with, specifically someone who's ready for a serious connection, totally open to having kids in the future, is a tall, rock-climbing Libra, and loves rom-coms with vegan pizzas on Tuesdays just as much as you do. Bumble knows that you know exactly what's right for you. So whatever it is you're looking for, Bumble's features can help you find it. Date now on Bumble.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hello, Jess.
All right. Today, we are going to talk about a somber but extremely important topic, suicide in teens. The clock is ticking, so let's get to it. All right, Dina. So rates of attempted suicide and successful suicide have been increasing for over a decade. And among children between the ages of 12 to 18 years, about 20% report experiencing suicidal thoughts. So, Dina, what are some risk factors for suicide?
So there are definitely a few risk factors for suicide in kids, which include a personal family history of mental health disorder, a familial history of suicide, a suicide attempt, a child previously attempting to commit suicide, excessive of social media use even, with self-reported video games and internet usage exceeding 5 hours daily was strongly associated with higher levels of depression and suicide attempts in adolescents. There's also social factors such as bullying or social isolation or being in a sexual minority such as lesbian, bisexual, transgender, or questioning. Also poor parental relationship, issues at school, stressful life events such as death of a loved one or sexual abuse. And finally, having firearms present in the home is definitely a risk factor. Even if they are kept unloaded and locked in storage, they're associated with a higher risk of completed adolescent suicide.
So who should be screened for suicide?
So the AP recommends depression and suicide risk screening for all children 12 years of age or older at well-child visits and is clinically indicated at younger ages when suicidal thoughts or behaviors or warning signs are present. So for adolescents, it's common at a child's well visit to ask the parent to leave the room to talk alone, since there's less of a risk of them withholding information when the parent is out of the room. So that's why commonly, please, when we ask you to leave the room, it's not to talk about you, it's just to gain more information to help your child. Confidentiality should always be maintained in adolescent healthcare, but in the case of adolescents at risk for hurting themselves or others, or someone else is hurting the child, safety always is the main priority for us over confidentiality. So this is very important, and asking children about suicide has not been shown to increase suicide ideation behaviors.
So what are some signs and symptoms that may be concerning?
So we often see kids feeling sad a lot of the time. There might be significant weight loss or weight gain. There might be decreased interest in pleasure in most activities, insomnia or hyperinsomnia, fatigue, lack of concentration, easily being distracted, thoughts of death, self-harm behaviors such as cutting oneself, depression or anxiety, school issues involving grades dropping or doing poorly at school. And often children will complain of many of these vague symptoms when they come in, such as stomach pain, chest pain, headache, being tired, dizzy, faint, or other nonspecific symptoms.
What about physical signs that parents can be on the lookout for?
So one of the top things I look at when I'm examining kids for risk of suicide, ideation or depression is cutting of the skin with multiple abrasions you can notice or scars on the arms or the legs. Sometimes we see some burn marks or severe scratching of the skin, pulling out of the hair, so lost hair, bruising from pinching on the body. Those are all concerning signs. There also may be signs of drug use, such as track marks.
All right, let's talk resources. If I suspect that my child is having suicidal ideation, what can I do?
So if someone is actively suicidal, have them go straight to the ER or call 911, since this is really an emergency that can't wait and a child needs to get help right away. We don't play around with this at all. So directly to the ER or 911. Management plans are multifactorial and depend on presumed risk, with high intent being a key determinant in the risk evaluation. So high-risk behaviors including children with an actual plan, a recent suicide attempt, saying they want to kill themselves and being able to do so, impulsive behavior, major depression, psychosis, or substance abuse are all considered high risks. High-risk patients need immediate mental health crisis evaluation with either hospitalization, sometimes involuntary if a risk of harm to themselves or others is present, and going to an emergency department. Some lower risk behaviors are harder to detect and may include more subtle signs of suicidal ideation, such as saying things like, I wish I get hit by a car while crossing the street, or I wish I fall into the train tracks. Those children who are stable without any active suicidal ideation still need help ASAP in outpatient mental health treatment. So there's calling 988 is a 24-hour suicide and crisis lifeline. There's the National Suicide Prevention Lifeline, which is 1-800-273-TALK. That's 1-800-273-TALK or 8255. There's also the crisis text line. So you can text HOME to 741-741. So that's HOME to 741-741. And of course, if there's any concerns, always reach out to your pediatrician and determine the next best steps.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
As a longtime foreign correspondent, I've worked in lots of places, but nowhere as important to the world as China. I'm Jane Perlez, former Beijing bureau chief for the New York Times. Join me on my new podcast, Face Off, U.S. versus China, where I'll take you behind the scenes in the tumultuous U.S.-China relationship. Find Face Off wherever you get your podcasts.